Just had a baby and don't know how to feel? Well, in today's episode of Dr. Nora, I take you through everything you should be expecting after you've delivered your baby. First up, congratulations. What an absolute blessing it is to have a little new bundle of joy in your life. What I think is the most important takeaway point of this whole video, and I can say this right now, is to remember that your body has gone through a number of humongous changes to be able to carry this baby, to produce placenta, which is a whole new organ by itself, and then to deliver this baby. So recovery is no easy feat. And as you'll find out in this video, there are a couple of really important changes that happen to your body once you have delivered, and you may not be feeling your best afterwards. There are lots of guides out there that tell you that women who've just had a baby really should either rest for 30 days, 15 days, 40 days, and really there is a lot of science behind this. And this is because, like I said before, pregnancy has a huge toll on the body. There are lots of different physiological changes that go on, and your body is actively trying to get itself back to its normal state as well. But in order for it to do this, lots of hormonal shifts need to occur, and this can have a massive impact on yourself. First up, let's talk about the uterine involution. What do I mean by this? Well, whether you've had a baby through vaginal or cesarean section, your womb has literally grown to accommodate the size of your baby. Now, the womb is usually really quite small, but you imagine that when you deliver this, say, 3-kilo baby, or even maybe a 4-kilo baby, depending on how big your baby was, your womb was really up here. So the womb has stretched massively. Now, the womb, otherwise known as the uterus, is a muscle, and so it can stretch to accommodate your baby's growing needs. However, what stretches must come back to normal again, because you don't see people who've just had a baby having a really big tummy after pregnancy. No, it does shrink back to normal again. And this is known as uterine involution. So a number of physiological changes and hormonal changes need to occur in the body for this to happen. Now, if you just had your first baby, you may not necessarily notice much pain when it comes to uterine involution. But if you've had your second or your third or your fourth baby, you will notice that this pain is a lot more intense. And generally, we tend to say that the more pregnancies you have, the more pain you'll have as well when this process is taking place. And when I say pain, I'm talking pain. This pain can be really quite severe for a lot of people. Of course, disclaimer, make sure if you are struggling with pain and it's not getting better and it's getting worse and you're feeling feverish or you're getting lots of discharge downstairs, then please make sure that you seek the advice of an adequately trained healthcare professional, because it may not just be uterine involution that's taking place, but there may be some other things going on, for example, such as an infection, which need urgent medical attention. But if it's straightforward uterine involution and it's all shrinking down, then this is what you should expect. Generally speaking, if you are breastfeeding your baby, then what happens is the body releases a hormone called oxytocin, which is the hormone which is actually released when you're giving birth to your baby as well. But now what's happening is the oxytocin actually helps to contract the uterus or the womb. So every time you breastfeed your baby, you might feel some contractions happening, and that is your womb just starting to shrink. And so it is thought that people who breastfeed their babies tend to have a quicker involution than those who don't breastfeed their babies. But don't fear, because if you're not breastfeeding a baby, you'll still have uterine involution taking place. But these pains and contractions may not just be when you're breastfeeding, they may be outside of breastfeeding as well. And as I said, this certainly may happen with your second or your third or the fourth pregnancy, but not so much with the first pregnancy, because generally speaking, the first pregnancy, you don't tend to have these afterbirth pains. But if you do, then afterbirth pains tend to last about a week or two, and they can be really quite debilitating. Now, like I said, your body has gone through some massive changes. If you've delivered vaginally, you've been pushing down, bearing down. There's been a lot of strain on your perineum. There's been a lot of strain on your bottom. There's been a lot of strain everywhere, essentially. And so all of these things are taking lots of time for them to heal, as well as your womb getting smaller as well. So it can take a little bit of time for your body to feel back to normal again. And like I said before, uterine involution, or the shrinking of the womb, may take up to 1 or 2 weeks for it to happen. And we tend to say that those pains can occur for the first sort of 3 to 6 days after birth, but for some people it may be a bit longer as well. Now, I know from personal experience that my pain did last about 2 weeks or so, and it was debilitating. I'm not going to lie. I literally couldn't get up from the chair. I had to be carried up. It was super duper duper painful. But thankfully, it's passed, and there is a light at the end of the tunnel. So if you are going through this, and if the pain is all just related to uterine involution, then it will get better. But just bear in mind that if there is another baby on the way, you might go through the same pain, if not worse as well. And speaking to my friends who've had multiple pregnancies, they said, yep, it gets worse every single time you've had a baby. So that's something to consider. The other changes that occur in your body, other than your womb going back to normal again and shrinking back down to size, is that the breast change as well. So if you are considering breastfeeding your baby, then obviously what will happen is the breast will enlarge, and the baby will, as the baby suckles on the breast, they release something called oxytocin and prolactin, which are the hormones that are integral to producing breast milk. And so the milk glands inside the breast do enlarge, and more milk supply is produced, and hence the breasts do get larger. So it's really important to get a nursing bra that is well fitted. So make sure that you go to a shop that will help to fit your chest area so that you can have some good support whilst you are breastfeeding your baby. Other changes that can occur after you've delivered your baby include problems with your bowels. Now, sometimes this could be constipation, and in which case we tend to recommend not straining on the toilet because this can lead to hemorrhoids. And certainly if you have been pushing through a vaginal delivery, you might have already experienced some hemorrhoids. Now, hemorrhoids are dilated veins that occur in the back passage, and they can be really painful and really uncomfortable, and they may also bleed as well. If you are experiencing hemorrhoids, it's really important to get some advice from your medical doctor to see what you can do to improve them. But what comes down to is making sure that you're not straining on the toilet. So if this means using a laxative to soften up the stools, then go for it. But generally speaking, making sure you drink plenty of water, you keep eating enough fiber, fruit and vegetables in your diet, then hopefully it should settle down. And you must remember as well, if you are breastfeeding, then you need to have extra water because the water is going to the milk, and so less of it's going downstairs, and that can cause a bit of constipation. Conversely, you may also experience some diarrhea after you've had your baby. And this really depends on person to person. It's because of the hormonal shifts that do occur in the body. So whether you're having constipation or diarrhea, they may be a normal part of after delivery, but they should subside and they should improve. If the symptoms aren't improving, then it's really important to get an opinion from your own medical doctor to have an examination and a checkup. Speaking of water, whilst it's really important to keep hydrated, and typically you will be drinking bucket loads of water, well, probably not that much, but you'll be drinking enough water to keep yourself satisfied, to quench that thirst that you'll have. It's also really important to keep a healthy diet. This means ensuring that you have got healthy fruit and vegetables on your plate, some protein, some lean protein. This all helps to aid your recovery. It's also tempting to go out and just get takeaway every day, but this may not necessarily be the healthiest thing for your body, and it also may not aid your recovery as well. And if you are breastfeeding your child, then you need to consider everything that goes into your mouth may also come out through the breast milk as well. So be really mindful of the foods you are eating, because you're essentially not just feeding yourself, but you may also be feeding someone else as well. Bonus points if you can get someone to help you, whether it's your partner or a family friend, or if you've had some meal prep from before as well, because let's face it, once you've had a baby, you need to rest, and resting is such an important part of your post-pregnancy recovery. In my opinion, resting is probably one of the most important things to have, because whilst you're going through all of these hormonal shifts, these bodily changes, you also need to get lots of rest. Now, with a newborn, this may not be the easiest thing to do because they're waking up every few hours, they want to have a feed, you have to tend to them, they have to change their nappies. But I would recommend sleeping when they sleep. Don't try to be a hero and think, okay, my baby is sleeping now, I can do all of my housework. If you're up for it, I can do all of my housework, I can clean the house, I can cook food. I would say take that time. It doesn't matter if you have a messy house, doesn't matter if you can't put the washing on the line. Just take that moment just to sit down, have a rest, have a little cat nap, and give your body some time to recover. It will surely help you. When you are resting, one of the other things that you may experience after pregnancy is sweats. Do not be alarmed. Now, when I'm talking about sweats, I'm not talking about just a simple dab of the forehead, a little bit of perspiration. This may be absolute drenching sweats, and that typically tends to happen when you're sleeping at nighttime, and it may be that you need to actually change your clothes or change the sheets because you are so sweaty, which is really uncomfortable for a lot of people. And this can last up to, say, 2 to 6 weeks, and it's all related to hormones changing as well. Obviously, if it is going on past that point and you feel a bit concerned, or if you're not feeling very well, it may also be a sign of infection as well. So be sure to speak to your own medical doctor if you are experiencing some sweats that are not the usual pregnancy sweat, because you may need some further investigations and examinations. A lot of people, after they've had their baby, may think, okay, that's it, I feel like 100 pounds lighter, I can go for a run, I can go for a walk. Well, not so fast there, because although you've had this wonderful miracle that's occurred, it is also important to take your time going back to exercise. Now, we generally tend to recommend returning to exercise after 6 weeks if it's permissible from your doctor. Of course, this does depend on your own individual factors, and certainly if you've had a cesarean section, it may be a bit longer as well. Or if you've had some stitches in place, then this may also change. So make sure you get your own targeted advice from your doctor. But if you are able to, then we tend to recommend going back to exercise, which could be just simple walking around, doing something really gentle after about 6 weeks post-delivery. During that first 6 weeks, when you're recovering from your pregnancy, it's really important not to overstrain your core. So this means that you're not sort of doing any heavy lifting or just lifting up your little baby. you may upset your core muscles. You have to remember that everything is stretched out. So your abdominal muscles have stretched out again, and now they're taking time for them to heal. And we don't want to cause any tears or any issues in our ab muscles or abdominal muscles if we are doing too much strain on our core muscles. Similarly, your perineum, or the area downstairs where you've been delivering, is also recovering as well. And if we put too much pressure on those areas by lifting too many heavy things, we may end up with some prolapses, or we may end up in future with some weaknesses of the pelvic floor muscles. And so it's so important to do your Kegel exercises to make sure that your pelvic floor muscles are nice and strong, and so we're not causing any weakening, because what can happen in the future is if we don't do those pelvic floor exercises and they get really weak, then we may end up with some incontinence issues in the future, which means leakages of urine. So those are a lot of the physical changes that can occur in your body after you've delivered your baby. But what about the other side of things? Well, certainly there are some mental health challenges that can occur once you have delivered your baby. Now, this could be anything from postnatal depression to the baby blues, and it's so important that if you are feeling a bit sad or upset after you've delivered your baby, that you ask for help. There is a wealth of help out there for those who are new mothers or new fathers even. And, certainly if you do have a new baby in your life, it can be really overwhelming for many. And particularly if you don't have much support around you, you can feel quite isolated and you might feel quite sad. And it's so important that if you do feel like you're not bonding with your baby, or you want to cause harm to your baby, that you urgently speak to a medical professional for help and advice. If you don't feel this way and you're just feeling a bit sad because you can't go out and see your friends, or you're feeling a bit locked up in the home, then I would encourage you to have a chat to your friends, whether it's on the phone or through FaceTime, or to encourage yourself to just go out and have a coffee with friends or a non-caffeinated drink with friends, because going out can really help to shift your mental state. And certainly seeing friends or having a chat to a friend on the phone can really take you out of that moment where it's just you and your newborn, who might be just breastfeeding all day long, going through a cluster feed or going through a growth spurt, and you feel really sort of closed up and you just need to have a chat to somebody. So it's so important to consider your mental health. There is just simply that you want to go and have a chat to a friend, or if you need some further help as well. But please make sure, if you do find yourself in the situation, that you do speak to a medical professional to get some help, because like I said, there is plenty of help out there and you are not alone. And we all really want to help you to enjoy that new moment that you got with your baby and to get that bonding experience. So there you have it. That is my wrap up of most of the changes that happen in the body after you delivered your baby. Like I said before, it is a huge deal on your body. And the most important takeaway point is to take it easy on yourself and really enjoy your newborn period, because they grow up so fast and you'll forget how small they were until they're a toddler and you think, oh my gosh, how are you so small? And so I really hope that as you embark on this fabulous journey in life, that you find this video useful. And of course, if you yourself have any tips or suggestions, please don't hesitate to drop me a line in the comment section below. And I hope you guys have found this video useful. Take care and stay healthy.